Maya Marquez Marshall, and this is my presentation, Research to Practice Project Mental Health. How can schools improve mental health in elementary students? Glenn Close once said, "What mental health needs is more sunlight, more candor, and more unshamed conversation." Did you know that 4.4 million adolescents have been diagnosed with anxiety? And 1.9 million children have been diagnosed with depression. Some key facts according to the World Health Organization: the fourth leading cause of death is suicide in ages 15 to 19 years old. Half of mental health disorders or challenges start by age 14 and most are undetected or untreated. Depression is one of the main causes of disability and illness in the world. Consequences of not treating mental health disorders in adolescents limit children to lead fulfilling adult lives. And although this presentation is on elementary school students, and one of the facts is suicide for ages 15 to 19, we want to prevent that. Here are some risk factors of mental health disorders: victimization, socioeconomic status, eating disorders, genetics, trauma, divorce, abuse, distance learning, home environment. And some of these factors are uncontrollable, such as genetics, but it's how we manage the mental health. Some risk factors in mental health: victimization and bullying. According to the study Roskauskas 2010, at least 1 in 10 children in grades 3 through 6 are bullied weekly, causing depression, low self-esteem, and low academic performance. Obesity. According to the study Habausch et al. 2010, obesity can lead to mental health problems that include low self-esteem, self-blame, and increased risk of health issues. Risk factors in mental health: trauma. According to the study Rochelle et al. 2019, trauma has long-term consequences when young children are exposed, and many of the young children are unsupported outside of school. The study reviewed how vital schools and communities are in supporting these children. The plan to minimize and reduce controllable risk factors with obesity. So step 1 would be to send an anonymous survey, and that survey would ask how many healthy snacks they're eating per week. It would also rate their self-esteem on a scale of 1 through 5. Step 2, provide health education on benefits of healthy snacks and moving more. Step 3, introduce the program Chef of the Week, which would be conducted on a weekly basis. It would also be a volunteer program, so whoever wants to participate, it would be in each of the classes, and the snacks would be easy to make. Step 4, they would write about their experience of Chef of the Week. The measure of success will be through observation in each of the classes if engagement has increased. It would be through reading the journal writings and a follow-up survey to see if there's been an increase in the number of healthy snacks and meals. Because the study Thomas 2012 discovered that once they implemented Chef of the Week, there was an increase in the healthy snacks the children were eating. The plan to minimize and reduce controllable risk factors with victimization or bullying. So there would be an anonymous survey as step 1 to see how many times children are victimized per week. It would also rate their self-esteem as well. Step 2 would be to provide bullying prevention training for students, teachers, and staff. Step 3, post signs and reiterate reminders from the prevention training on a weekly basis. Step 4, create an anti-bullying club for grades K through 6. It would be volunteers from each of the class, and any ideas they want to implement, they can bring them up to the teacher. Measure of success will be through observation in each of the classes and a follow-up survey to see if there's been a decrease in weekly victimization. The plan to help manage and support students with trauma. Step 1, anonymous survey to inspect if students are aware of mental health resources available at the school. It would be a fill in the blank to see if they can write all the resources and how to locate them. Step 2, provide education on mental health and mental resources available at the school in each class on a weekly basis. Step 3, reviewing different coping strategies dealing with trauma on a monthly basis in each of the classes. The measure of success will be through an anonymous survey to see if there's been an increase in known resources. So students are more aware of how to locate the resources, what they are, and how to use them. Here are my references, and I hope you enjoyed this presentation. Thank you.